නිදහස් සංවාද වැඩබිම පක්ෂ දේශපාලනයට එපිටි transcends party politics.
I, for one, would use the vaccines for the vulnerable group, that is those over 60 years of age and those who have other serious diseases that may reduce the immunity and lead to severe illness and even death. Now, diseases like chronic pulmonary diseases, cardiac diseases, diabetes mellitus, then cancers and so on would come into that category. Now, Sri Lanka is a relatively poor country and vaccines are expensive. We have been fortunate that WHO has supplied 20% of our population's needs free of charge. Now that I would be inclined to use that against the vulnerable group that I mentioned, because those are the people who are liable to get serious disease and a few will die. At the moment, the death rate among those who get infected in Sri Lanka has been in the region of about 1%. So it's not a big amount, but with time, especially with the Delta variant appearing, we can't say what might not happen. Therefore, we should reserve the vaccine for those who come into this danger group and ensure that they get both doses of vaccine and the necessary boosters with time. Now, with regard to the rest, as we know, the evidence seems to point to about 80% of those infected not having a danger of dying or getting a severe disease. Most of them are asymptomatic, show no symptoms. And if that is the case, and only if the others develop minor symptoms, then this is not a big problem. Every year in Sri Lanka, we have influenza outbreaks in a certain time of the year when the northern winter approaches. We don't take any special notice of that, and the special precautions are not taken. So I think Sri Lanka has other priorities which it should pay attention to. 60% of our population are below the poverty line. They are hungry. They don't get sufficient nourishment, and they are more liable to fall ill and get severe illnesses, and we must give the highest priority, in my view, to supplying food for those people who cannot afford it. Because due to various reasons, like in most countries, Sri Lanka also, there is a large population who have lost their jobs, who have lost their sources of income, people who are unable to buy the goods which are, the price is being continuously raised by unscrupulous traders and middlemen who want to make maximum profits. So faced with these two alternatives, I would put my weight on the side of seeing that we overcome the problem of hunger and make sure that those people who do not get sufficient to eat are given food by the government, even free, and then only the vaccine is given free. So there is no reason why we can't give food also free. So we should do that first and then give the vaccine as and when we are able to get sufficient vaccine at an affordable rate. Then only continue to give the group that is not in the vulnerable population. Because for the intermission of transmission, we would need to vaccinate at least 70%, if not 80% of our population. We have now, I think, just reached 10% of our population vaccination. So we have a long way to go. Therefore, rather than thinking of that, I have proposed that we should have a very good health education. We have an educated population in our country. Standard of literacy is high. They can be taught the 4 health rules, which will not collecting in big groups, social distancing, wearing of masks, and washing the hands immediately one touches something which has been touched by anybody else. If those with soap and water, if that is done, which can be done very cheaply by our population, we should be able to keep the situation under control. Otherwise, I am afraid we will have 2 big problems, because with hunger, the people who are hungry become also more liable to develop the COVID-19 and get severe disease. So, in taking all that into consideration, I would give first priority to feeding the hungry, and then only try to vaccinate the population in a very orderly manner, in thinking in terms of the risk of infection as the priority. Thank you.
නිදහස් සංවාද වැඩබිම පක්ෂ දේශපාලනයට එපිටි Transcends Party Politics.